This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Well, you know, we talk a lot about chronic conditions that are affecting more and more people in this country. This month, the focus, of course, is on heart disease and how to prevent it.
Another chronic condition that comes with a whole lot of problems is diabetes. And today, we're going to focus on the problems that it can create for your feet. Here to help us with that is Dr. Kevin Thomas of Thomas Podiatry. Thank you so much for joining us today.
Thank you for having me.
So, diabetes is like really prevalent.
Correct. Yes, it is.
30 million Americans, is that right?
That we estimate. More than likely, the numbers are quite higher. So of the 30 million that are diagnosed as diabetes or diabetic, we have at least another 7 to 10 million that are diabetic and don't know it. They've never been tested. They don't know. And then on top of that, we have another 80 million people in the country that are pre-diabetic and actually diagnosed. So we're looking at 35–40% of our whole country's population that is either diabetic, pre-diabetic, or may not even know.
Wow, that is amazing. Okay, so that means you're seeing more patients with chronic wounds that are a result of diabetes?
Correct.
Explain that.
We do see a lot of open sores, ulcerations, wounds, whatever you want to call it. It's all an interchangeable term. Unfortunately, these numbers are going higher and higher with the greater incidence of diabetes, people not controlling properly. It's a long mechanism of complex problems that can create a wound, but to simplify it, people that are diabetic and don't properly control it, they get numbness, tingling, they lose feeling in their feet and their toes, and often that will precipitate them to getting an ulceration because they don't have feeling, they don't know if they've got a cut, they don't know if they've got a scratch, they can't feel it, so it becomes out of sight, out of mind.
So early detection, like pretty much everything else, is pretty important.
That is correct. What I emphasize to every single diabetic person that walks in the office is check your feet, get in the habits. If you can't see, have someone check for you. If you can't visually see, put a mirror down there. If you still can't see, use your other sensations. Use your sense of touch, your sense of smell. If you have an open sore, sometimes it does have an odor to it. So use your other senses to analyze and examine yourself.
Okay, so patients, whether they're diabetic or not, should probably keep an eye on their feet, looking for things. What can they do to take care of their feet to prevent it in the first place? Again,
as we mentioned, obviously just inspection is key, but also just daily thorough washing. Something as simple as that. When you're washing, you are putting your hands to your feet. Simply put, if there's something abnormal, you might feel it, you might notice it. So just wash them with a mild soap and water, drying properly between the toes, and then put in some sort of cream or moisturizer, but not between the toes on the feet. Daily habits of doing that goes a long way.
So do people not dry their feet?
People dry their feet. Unfortunately, they don't dry between their toes. When they may have a deformity, it can trap moisture in there, and that can turn into a blister and even an open ulcer.
Oh boy. All right, so let's talk about
I don't dry between my toes.
You don't dry between All right, well, you're going to now.
I will now.
Okay, so let's talk a little bit about these wounds that you're seeing, and sometimes you see them when they're too late and surgery is needed.
Unfortunately, sometimes surgery is needed. Sometimes it could be as simple as wound debridements that we perform in the office where we remove some dead necrotic tissue. Sometimes people have an open sore because it's of a deformity or an injury. They may have a crooked toe or a crooked foot, and a lot of times they can be straightened out to correct the deformity and heal the ulceration at the same time.
Worst case scenario, what would that be?
Unfortunately, we do see amputation, whether it be a tip of a toe, a full toe, part of the foot, sometimes even goes below the knee, sometimes even extreme cases above the knee amputation. So it can, there's varying levels. There's obviously at this point there's other comorbidities involved in terms of sometimes heart disease, how much blood flow they have, the other risk factors including do they smoke, do they have any other medical conditions that are preventing them from healing and getting better.
And this is nothing anybody should be ashamed of or afraid to show you.
Absolutely not. Absolutely not. Again, at this point, 25% of all diabetic patients will get some sort of open sore in their foot in their lifetime. So we see it a lot. It happens a lot. And we estimate that by the year 2030, probably half of our population will be diabetic. So we're going to have a lot more people getting open sores, unfortunately. But the key is get them checked early. A lot of times we can prevent. Probably 85–90% of all diabetic amputations can be prevented.
Wow. Really?
Mm-hmm.
So get it looked at.
Exactly. Get in and get it checked. What I often, and pretty much any person that sees me that is diabetic, I will state the same simple phrase to them. If you have a cut, a scratch, an open sore, a stubbed toe, a break in the skin, I'd rather you come in, get it checked out, have me or one of my colleagues say, all right, no big deal, or hey, we got a problem here, let's fix it.
Yeah.
Never bad say.
Prevention's the key.
All right.
Thank you, sir.
Thank
Dr.
you.
Kevin Thomas with Thomas Podiatry and Associates. Thank you so much.